Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Andrew Wilner. He's a neurologist, and today's Kevin MD article is titled, Will Artificial Intelligence Replace Physicians? Andrew, welcome back to the show.
Thanks, Kevin. It's a pleasure to be here.
So Andrew's been on, I think, about 2.5 years ago. And for those who don't remember that far back, just briefly share your story and journey.
Well, I am currently an associate professor of neurology at the University of Tennessee Health Science Center in Memphis, Tennessee. So that's my day job. And for many, many years, my other job has been that of a writer, and I write medical news articles for Medscape and other publications. And I do a lot of interviews actually like this for Radio MD, Reach MD, Medscape, and because I like to know what's new and what's going on. And I also have my own podcast called The Art of Medicine, where I interview people who I like to interview physician authors who've written, books, either nonfiction or fiction, or people who are doing interesting things, usually outside of their kind of regular jobs. And so, because I do like to stay on top of things, this issue of artificial intelligence came up. And there were a lot of articles, and suddenly there were hundreds of experts. It's like, I don't know how there's so many experts. This thing's brand new, but there are people who are, and I even interviewed an expert, an engineer on my show about artificial intelligence. But I thought I should weigh in on how it's going to affect the medical profession.
So you've been on multiple podcast interviews, you've written for multiple publications. What are some common questions you get asked regarding artificial intelligence and the intersection with physicians?
Well, I think the most poignant question, I actually got a question through my website, andrewwilner.com, where usually I entertain questions about locum tenens because that's my other interest. I did that for many years and wrote a book about it. And a woman from Australia wrote to me. Actually, I think she left me a voicemail that her son was considering medical school. But did I think it would be a waste of time now that there would be artificial intelligence? And should she encourage him to do something else? And I thought, wow, that's really something. And I think in the back of everyone's mind, there's kind of that question. When I wrote my article, the issue is, well, is this going to put me out of business? And can artificial intelligence do what I do? And I think, well, the answer is actually very complex. We all use artificial intelligence every day, right? On your phone, you can dictate a message, right? And somehow your words turn into your voice turns into words that are typed. I mean, that's pretty amazing. It can, however, put people out of work. Every doctor's office used to have a back room full of transcriptionists.
Yeah.
And I remember I used to dictate into a tape recorder, and then I would leave the tape, on the counter. And the next day there would be 4 busy ladies in the back room who would be typing it and complaining about people's accents or mumbling and have to go back and review. And I would not encourage anyone to be a medical transcriptionist. I think, that has gone by the wayside. And similarly, my dad was a CPA, a certified public accountant. And I remember as a kid, I'd say, Dad, what are you going to do today? He's going to the office. Say, well, he had a client who had a men's clothing store, a big men's, selling suits and sport coats and things like that. And he said, well, we have to shut down the store because we're going to take inventory. Somebody would, this sounds incredible, right? To somebody who was, born in the last 20 years. They shut down the store and manually count every piece of clothing and label it so they would know what they had sold and what they hadn't sold. Well, of course, and they hired people to do that. Well, those jobs are gone because we do that with barcodes now, right? Every store manager knows at the end of the day exactly what sold and what didn't sell, because it's all done, it's all automated on the barcode. So there's no question that computers are pretty powerful and can change our lives and can put some people out of work. But my take on it was that computers are really good for information
Hmm.
retrieval and information storage. And medical students, right? We spend a lot of time learning information, anatomy, the names of drugs, their half lives, their indications, their side effects. That information now is much more easily retrievable, right, than it used to be. I have an app on my phone, pdr.net. I used to have a giant book, right? You
Hmm.
remember that you're
Yeah.
probably old enough to remember the giant PDR books that were on every nurse's station, had all the information. Now it's on an app. So AI is good for that. AI is good for pattern recognition. AI is being used for pathology to look at a slide. Is this a benign mole or is this a malignant melanoma? AI is pretty good at that. AI can read EKGs. That's been going on for 30 years, right?
Hmm.
The EKG comes out of the machine and it's got an interpretation. However, that interpretation is not always right. And AI has to be overread by somebody who actually knows what they're doing. Why? Well, one of the issues is artifact. When I go back to learning BASIC when I was in college and
Hmm.
Fortran, when computers were as big as my office here, and there was a saying GIGO, garbage in, garbage out. And one of the problems is when you say, well, we can monitor patients' blood pressure 24/7 or their oxygen, but it's not always right.
Hmm.
And if that information, if the raw data isn't right, well, the output isn't going to be right. And computers aren't that good at determining whether the raw data is useful. So that's a very, very big limitation because, well, this is going on right now, right? In
Sure.
other areas. If I tell my accountant how much I earned and that information is wrong, well, my accountant's calculation of how much I owe in taxes with their computer program is going to be wrong. So, getting the data right in the first place, very, very important. And I think that's a big limitation that's kind of been skipped over in AI. The other kind of obvious limitation to AI is that AI is not a person.
Hmm.
And doctors do a lot more for patients than simply follow algorithms. In other words, if you come in with an infection, an algorithm will tell me what is the best antibiotic and what's the dose. The computer will tell me that. But then I have to convince you that that's the best thing to do to take it and how to take it and how long to take it and how it's going to interact with your other medications. And you have to have confidence in me that what I'm telling you makes sense. So you don't try herbal therapy or just do what your neighbor did. So I think artificial intelligence is a great tool, just like a calculator. I don't know. When I was in school, we had to memorize multiplication tables, right? And division and all of that. Now you just pick up the
Hmm.
calculator, and every now and then I want to do some quick calculation in my head, and it's like, I better use the calculator because I'm rusty, right? I mean, the calculator is going to be right more often than me. I can guess pretty well, but the calculator is always right. It's a
Hmm.
machine. But I don't really want a calculator when I go to the doctor. So, what I wrote in the essay is that physicians who rely only on algorithms, I think, will be replaced because the computers are going to do algorithms, take data and come up with a solution, or these are the guidelines. And they can remember all the guidelines a lot better than I can. I can look them up, but the computer will have it in a split second. But dealing with the patient, the laying on of hands, I mean, this is historical. Why have there been physicians for the last 5,000 years? They didn't do much. They didn't have antibiotics. They didn't know anything, right? But there was always a physician. Why? Well, because the laying on of hands, physicians knew or had a pretty good idea about prognosis. Where is this going? Am I going to die, doc, or am I going to be okay? I need to know. And how can you alleviate pain? How can you reassure me?
Hmm.
How is this going to affect my family and my job? I think it's going to be a long time before AI is able to sort of manage the the human considerations of illness and disease.
Do you see a scenario where AI has any role in enhancing that human aspects, whether it's taking some of that electronic medical record, things that doctors have to do in the exam room so they can better focus on the patients? Are there any scenarios you could see AI in the future perhaps enhancing that relationship with patients?
Well, I think it would be great if AI could flag things like that sometimes get buried, right, in the history. Like this patient's, father died, at age 40 of colon cancer. That's important for the
Mm,
doctor to know. But a lot of the specialists zooming in and out don't take family histories anymore. So there ought to be a little red flag there. Similarly, screening for depression can be done very simply with just a few questions. It gets buried in the EMR. A little flag should come up. This patient, had a positive
mhm.
score, something to think about, something to be aware of, prior hospitalizations, for the same thing. I think AI could really do a great job if it had access. And of course, this has been discussed. If it somehow could not only read the fields but also read the text, right, of the doctor's note. The AI that we have now tends to just look at fields. One other area, very recently, there was an article that suggested that AI could interpret electroencephalograms, which is what I did a 1 year fellowship to learn how to do, as good as people. And it's like, whoa, am I going to be out of a job? Well, no, because it still makes mistakes. But one of the things it could do is we sometimes monitor patients 24/7 with brainwave studies.
Yeah.
And that is very time intensive to review. And frankly, it's humanly impossible to get a pile of these things or a computer disk full of 4 patients that were monitored last night and review it in a obsessive compulsive way if you're a human being. But a computer with the right algorithms and the ability to separate artifact from brainwaves, if it could do that, that would be like me having a full-time assistant, a highly trained assistant, without actually hiring one. So I think there's a potential for AI to really contribute. But again, I always think of GIGO. That
Yeah.
that is huge. The AI has to be given a sample that is meaningful and accurate, or what comes out the other end may look great. And of course, there's been a lot of stories of ChatGPT where people are saying, "Oh, tell me about this," and the computer's just making
Yeah.
stuff up,
Yeah.
and pulled up, Napoleon was active in World War II, just stuff that's just completely that anybody would know is wrong, anybody except the computer. So I think AI has a long way to go, but it's certainly going to be part of our future tools.
I think that with AI or ChatGPT specifically, it's been out for about a year now and it's already made so much progress. So I think it's a reasonable assumption to assume that a lot of the errors that we're talking about now in terms of reading EEGs and EKGs, the error rate is going to significantly decrease with the next generations of AI. Now, what can physicians do to maintain their humanism, to maintain that doctor patient relationship that AI can't replicate going forward? Because AI, if it gets more accurate, is going to take some things off our plate, but it's never going to replace the relationship. As physicians, how can we maintain that relationship with that improving AI context around us?
Yeah, I think that's a great question. Well, one approach is to improve the system, right? Having more time, being less rushed, all of those things. It's hard to have, you and I are going to have a conversation. And if you tell me, hey, Andrew, I got 5 minutes, it's like, well, okay, that kind of puts me off, right? But you said, hey, Andrew, I got all day and you just tell me what's important to you. All of a sudden, the whole tone, of our conversation is different. Well, obviously, doctors don't have all day for each
Hmm.
patient. The good ones actually pretend they do. And I've heard patients say that he talked to me like he had all day. Well, of course, he didn't have all day, but he didn't look at his watch. He didn't get interrupted. He didn't fiddle with the computer. He didn't leave the room. There are system things that can be done to enhance the doctor-patient relationship, which I would say in general, the opposite is occurring, right? Doctors are more rushed than ever. They're
Hmm.
interrupted more ever. They're asked to do things that are way below their skill level, like typing. So the system, there's a lot of low-hanging fruit there to fix that. I would say the other thing is sort of a mental kind of awareness, a situational awareness that what I really have to offer to this patient is not only my knowledge, but my heart and my soul and my caring. One of the things I started to do intentionally is when I get to the patient's room, my instinct is just sort of to barge in there and get going because, a lot of other things to do. So I try and remember to just stop at the door and breathe
Hmm.
for like, a second and just let everything stop. And then take a breath and then go in like it's a new day, it's a new person, and kind of leave everything behind. I mean, that literally takes about 3 seconds. So I think that's a recommendation that other people can try, without messing up their day. But I think it's a situational awareness, hands-on. Touching patients used to be a lot easier. Now there's, always concern that the touching is somehow inappropriate. So I think that has sort of created a bigger distance because laying on of hands is important. When someone actually touches you, there's a connection. If it's unwanted, that's a problem. But hopefully, when you're with your physician, you want that human. I know when I go to my doctor, I always tell him irrelevant things about my
Hmm.
life that have nothing to do with the case. I don't know. You may find it annoying, but I want him to remember me as a person, and not the guy who came in to get his creatinine checked, or whatever it is. It's, oh yeah, he was ranting about this or that, but because he's a human being too. So
Yeah.
I try and make that connection. So I think the human connection is, as you suggest, extraordinarily valuable.
What do you anticipate the second year of AI to bring in our lives as physicians?
Well, one area it might help is writing letters. I do a lot of writing. That's what I do.
Yeah.
And I asked Chat GPT to write me a letter the other day. Like a lot of people in the world, I want to raise. So I told Chat, I said, I want to raise. And I gave it a few specifics. And it wrote this beautiful 4-paragraph letter that
Yeah.
frankly would have taken me all day. And had some things in it that I wouldn't have thought of to put in, like what a great job I've been doing, not just inflation. Anyway, it had to be edited, but it was kind of an exercise. So I think it's a way to get started. I don't think it can replace writing because usually when I write, I don't really know what I'm going to write until I sit down and write it. So I don't want to skip that step. The step of actually making yourself write it is when you figure out what you want to say. So if you just let Chat GPT do it, you kind of missed on all that maturing thought process. The other hand, it is a great way to get started and not to forget things. I do use a writing editing program called Grammarly. I don't get any thing from Grammarly for recommending them, but I've used it for several years and I found it very helpful to just identify. Sometimes I'll use the same word over and over
Yeah.
again, without realizing it, or I forget a comma, and it picks it up. And often it makes suggestions that are wrong. And I think that's the key thing, that none of this can be taken as face value. It'll say, oh, you should change this word to that. It's like, no, no, that's not what I'm saying. So you have to be smarter than the AI for sure, but it is a useful tool. I think it would be great to plot vital signs, to plot creatinines.
Mhm.
I mean, I think our EMRs, which are, we could have a whole session on that, and I've written about EMR, but they're an embarrassment, right? I mean, they could be so much more useful, and maybe AI could help get them up to speed so that they're useful tools instead of giant paperweights.
We're talking to Andrew Wilner. He's a neurologist, and today's Kevin MD article is titled, Will Artificial Intelligence Replace Physicians? Andrew, let's end with your take-home messages for the Kevin MD audience.
Well, I think the bottom line of my essay and our discussion today is that physicians really separate themselves from AI by being thoughtful, kind, compassionate. And I think physicians who are growing up today, who are going to be using AI more and more, need to really focus on their people skills and to make themselves really valuable to their patients.
Andrew, thank you so much for sharing your time and insight, and thanks for coming back on the show.
Oh, it was my pleasure, Kevin. Thank you.